you get an output. Hello? Hello?
Continue, doctor.
Hello? Are you still
Hello.
on?
Yeah, we are on.
Yes, we are.
Oh, good, because it gave me a warning that I was getting off. So the outcome of you expending resources is an impact, an outcome, an output. All these terms are what we now want to look at as consequences. Okay, now, in our case, you have gone to a hospital and you have expended some resources. So you have, for example, bought medicine. When you take that medicine and you restore your health, okay, then that restoration of your health is a consequence. Okay, and we will look at these consequences and compare them at a later in a few minutes. So consequences are any of these outcomes that you get, those things that give you a result, or the result of you incurring costs. Okay, so costs generally deal with the production side, while consequences deal with the output side, or the consumption side. So for any cost incurred, there will be a consequence. And it could be beneficial or not beneficial. In health economics, we look at the beneficial consequences, and if there are any negative consequences, we assume those to be costs. Okay? Now, there are ways of considering consequences. Some consequences we will call benefits. Other consequences we shall call effects. And other consequences we shall call utility. So you have effects, you have utilities, utility, and you have benefits. Okay? When we talk in economics, normally all costs, as we said, we define in monetary terms, but consequences are sometimes expressed in non-monetary values. Okay, so we have non-monetary values which measure consequences. For instance, effects and utility are measured using non-monetary measures such as disability adjusted life years. Disability adjusted life years. We will call it DALY, D-A-L-Y. Or the quality adjusted life years. Quality adjusted life year. That means you look at the consequence in terms of what amount of disability did you have you salvaged, or what type of quality of life have you remained with after you have incurred the costs. Perhaps a way to illustrate is like this. None of you wants to die, even those of you who want to go to heaven. Are we right?
Yes.
Good. So when you become sick, you seek for medical attention, isn't it? And you pay for this medical attention. And perhaps when you become sick and you go to ICU, like we've just had over the last 2 years with the corona, maybe when you come from ICU, you come and you have some disability, maybe a dislocated arm or a dislocated leg. So we will measure the benefits that you got from what you are not able to do now. Let's say if you are a sportsman or a sportswoman and you have a broken leg, will you be able to still continue with your sporting activity if it was running?
No.
Okay, so we will adjust for that disability, and we will adjust for the length you stay with that disability. That is why we say disability adjusted life year. So we'll take the amount of life you have remaining with that disability. And we can also go further and say, yes, you might get a disability, but this disability does not really affect your quality of life. You can substitute, okay? So you can get a condition that really makes you miserable. Let's say, for example, you can be paraplegic. You get paralyzed, so you are wheelchair bound. Now, at that point in time, it goes slightly beyond disability. It now goes to look at the quality of life. Henceforth, if you are paralyzed from the neck down, but you have not died, you have refused to die, but you are alive but not as active. Your quality of life becomes now an issue. So we talk about adjusting your life with the quality of that life. So we talk of a quality adjusted life year. And this is important because the consequences that you get from consuming various things, or the output or the outcome of you incurring costs, vary. They vary in terms of effects or effectiveness. Okay, like we said, if you have a slight disability, it's different from if you have a serious quality issue. And then the utility, the usefulness. We talked about, say, for example, the consequence in terms of what it is you do for a living. If you are a runner, your leg is more important than your hair, okay? So the utility of the consequence would vary, okay? And therefore, we now want to go deeper to Dogo. Effects, what are the effects? We say, what are the effects? In economic terms, we say effects are changes in physical, social, or emotional function. Effects are changes in physical, social, or emotional function. And some of these effects are positive. When they are positive, and if they are negative, we treat them as costs. Okay? And we have given an example. Benefits are the desirable outcome of a production process. You know, what is the desirable outcome of a production or you incurring the costs? So desirability is a function of culture, tastes and preferences, value systems, and so on of an individual or society. So for example, we have given the example of the fellow that is a runner, his benefits, the benefits from his leg are different from if you are a weaver who uses your hands more. Utility is the ability or a good or service to satisfy your need or your want. The ability of a good or service to satisfy your good or, to satisfy your want or your need. So that incurring costs to get an output, that output for example, when you go to, if you are sick with malaria, which drug is most effective? I know this one you all know. Which drug is most effective for treatment? Atinaitwa AL. Good. Now, you see, that is, you will say that that drug has greater utility than other drugs, isn't it? So utility is the ability of a good or service to satisfy your need or your want. Okay? So that economists think of utility as fairly subjective. It's fairly subjective. So that it is very difficult to know the utility for every individual. But what we do in economics is we get the gross, the total utility, and then we use it to make our decisions. So we have said that consequences must be valued in order for them to make sense for us as economists. We must value our costs and we must also value our consequences. Okay? And we have said in passing that we have ways of valuing consequences. Costs, we value all of them in monetary terms. Consequences, we value them in various ways. And we have given 2 examples in passing, and that was disability adjusted life year and quality adjusted life year. Then there are other ways also of valuing consequences, and these are intermediate also, and they are, for example, healthy days achieved. How many healthy days have you achieved by incurring the cost you incurred in consuming what you consumed? Or deaths averted, How many deaths have you prevented? How many fellows have you prevented from going to heaven? So deaths averted is a measure or a valuation. And so you have healthy days gained, deaths averted. And then some of these also are a bit more advanced, and you deal with more of them maybe later in your postgraduate. There are other ways also of valuing, and that is, for example, what we call the human capital approach. How much are you willing to give up in order to remove a discomfort? And then you have the prospect of what we call willingness and ability to pay. Willingness and ability to pay. How much are you willing to sacrifice? If you are told you have corona, or if you are told you have a terminal disease, how much are you willing to give up in order to prevent yourself from dying? Oh, today's lesson is gloomy, it's about dying. Eh? I'm sure none of you wants to die. Okay, so in the health system, we say that what people are willing to sacrifice can be catastrophic. Some of you will sell all the land that your father gave you in order to pay so that you don't die. Okay, so that is willingness and ability to pay. Those are some of the measures or that we use to value consequences. Are we still together?
Yes. Yes.
Yes. We are still together, isn't it? Good. So now that we have dealt with the concept of costs and consequences, let us now put these into some use. Now we want to discuss economic evaluation of health services. The reason we are taking this course is so that it will help you with decision making. And you will make decisions by evaluating, isn't it? Right? You make decisions by evaluating. We said at the beginning that health economics is the business of looking at various alternatives. Okay? We said we look at various alternatives which have productive uses. And we talked of efficiency, and we talked of equity, and we talked of all those things. Now, because anything we do is in lieu of doing something else, economic evaluation is therefore an analysis or an assessment of the various projects of policies in terms of whether or not they are improving a community's welfare or an individual's
Hello.
Am I talking?
presentation in PDF. Daktari is saying that he's solving his issue in the next 1 minute. So he's asking that you guys be patient kidogo tu. Meanwhile, as we wait for Daktari, I'm uploading the other classes. I'm creating a YouTube channel for this class. I'll share the link either today or tomorrow morning so that you can watch the lectures again at your own free time.
This class.
That's actually a very good idea.
Hello.
Hello.
Paul, I don't know what is happening today with our network. Maybe we are not as urban as we thought. Okay, so we talked about that with this economic evaluation, we are looking at various things. In the way when we consume our health services, the consequences that we get. And we said that we look at various things. For example, we look at technical efficiency, how efficient are our services so that we can make decisions. We look at allocative efficiency. The activities we are undertaking, you know, how well do they allocate health services for everybody? How do they allocate resources to the whole health sector and to the individual? So you look at technical efficiency, you know, how easy is it to allocate those resources? You look at social efficiency, you know, and equity. Does everybody get health services, or does everybody get the activities we undertake as they need? Remember, sometimes we say from each according to their need, and from each according to their means to each according to their need. So economic evaluation will help us make those decisions, okay? And it is important. Now we have 4 ways of carrying out this evaluation. And before we talk of the 4 ways, there are some steps that we need to undertake before we carry out economic evaluation. First, we must identify the project or activity that we want to evaluate. Secondly, we must identify all the costs that will be incurred by that activity. Third, we must identify all the consequences that will result from that activity. Then fourth, we must compare both the costs and the consequences. And that way now we make a decision. Okay, so it is very important for you to notice that that needs to happen. Those steps need to happen. When we do economic evaluation, we have 4 methods. We have 4 methods, okay, for doing economic evaluation. We have cost minimization analysis. Cost minimization analysis, we also call it CMA. In this, we examine alternatives which have the same results, and the only difference is the cost. So for example, if we went back to our malaria thing, if you use malaria drugs, you will be cured, isn't it? Hopefully. But you can also use preventive methods and kill all the mosquitoes. Then you will not catch malaria. All of those 2 activities will make you free of malaria. But what is the cost of using drugs vis-a-vis the cost of killing all the mosquitoes? Perhaps it is very expensive because you will have to spray, and then when you spray also, you poison your water body, you poison your lungs with the spray. So the cost of preventing you from getting malaria or making sure there are no mosquitoes to give you malaria is higher than the cost of you getting a few anti-malaria drugs for 2 or 3 days or a week, and then you are cured. So the only difference there is of cost. but the outcome is the same. You will be free of malaria. Now, cost minimization analysis will only identify the alternative with the least cost. The alternative with the least cost, right? But the result is the same. Then you have cost effectiveness. Cost effectiveness analysis will compare the costs and the effects. The costs and the effects. Now, it is also called CEA. Now, here, you have a health service or a health activity which is capable of achieving certain objectives at the lowest possible cost. So it's either you are able to achieve the objectives at the lowest possible cost, or you are able to maximize the benefits to be gained from a given health budget. So from a given set of resources, you're able to achieve the highest cost. Now, this CEA is important because it can be employed to present a series of choices capable of yielding a better performance from a given budget. So here you have an amount of budget, and the cost effectiveness analysis will enable you to decide on which activity will give you the greatest effect for the least cost, or the most effect for the least cost. Okay, I know now that you are tired, you are thinking, when will this guy keep quiet? Now we have another one. It is called cost utility analysis. Cost utility analysis, you are comparing the costs with the utility. You are measuring the results of a program or a project in terms of its utility. That is, you are looking at the quality of the benefit that you get, or the usefulness. Okay, and when you are doing that, you're saying, what is the cost of maximizing the utility of the consequence that I get? So that is where now you use those measures. The fourth method is the easier one that every one of you has had, the cost-benefit analysis. So here you value all your costs and all your benefits in monetary terms. Okay, and this is done over a specific period of time in order to help decide whether or not, if costs and benefits are identified, measured, and valued, a particular strategy is worth adopting. We want to say, is it necessary to undertake this activity? So you do a cost-benefit analysis. You compare the costs and the benefits, and all of them are done in monetary terms. And so you divide costs by benefit, compare the two. If the costs outweigh the benefits, so is it necessary to undertake that activity?
No, it's not.
No.
What about if benefits outweigh the costs?
It is.
It is, isn't it? So by doing that cost-benefit analysis, then you're able to decide that this is worth doing or not worth doing. Good. Now, I think I have talked non-stop. I want to entertain some questions to make sure that you have understood these concepts. And I'm hoping, of course, that you have taken time to look at your overview. Are there any queries? Any queries? No queries?
None. Seemed like it was clear.
Yes, it's either that it is very clear or that you understood nothing. Okay, so that kind of finalizes our health economics component. Next week, we will deal with our health sector financing, but please take the trouble to read and understand your overview notes and other references. And if there are any issues you think you do not understand, you can always use the email or something to ask for clarification. Okay, we have tried to simplify the course for you because also the time you chose is a bit tedious for you, but it was your choice. And you remember we said choices have consequences. I see a lot, you are very few today. I hope your colleagues will take that trouble. So next week we shall deal with health sector financing. But if for some reason there will be any changes, we will communicate to you, okay? So any queries about the course so far? Any areas you think we didn't cover well? Good. So if there are no queries, no clarifications, I say for this week, goodbye. At least today we finished slightly earlier. So please, muji enjoy. Bye.
Thank you.
Thank you. Bye.